Hey, everybody. It's good to see you. I hope that you're doing well. Today is one of those days when I didn't look at what I looked like before I came on here, so that's just the way it is. Um, I wanted to welcome you to my YouTube site where I'm going to be posting maybe some snippets of my old um, videos that I did, but also some new stuff. Pardon me. Mm. Today, I wanted to talk to you about something called radical acceptance. I have made a little journal about some things that I need to radically accept. I am not very good at radical acceptance. I guess this is probably backwards, so I'll have to put a photograph in there for you. I don't know if you can. Camera's getting a little funky. But radical acceptance is a concept that was developed by Dr. Marshall Linehan, who was the inventor of DBT, or dialectical behavior theory. And DBT is a mix of CBT, cognitive behavioral therapy, and extra skills. So it's basically a skills class, a skills curriculum where you learn how to combat some negative behavior, some things that feelings, certain thoughts, certain behavior, certain things that cause you to end up in a lot of pain. Usually it's the tip-top premier thing, therapy treatment for borderline personality disorder, but it also works for other things as well. PTSD, I think, is another one of them. Grief. So those are some examples of things that it might be used for. I take a DBT skills class through the University of Texas in San Antonio once a week on Tuesdays, and every week we go over a new skill, and then we do some homework for the next week, and then the next week we go over our homework and just see how we were able to do it. It's a great class. I really like it. I really recommend it. I'm not sure if it's something that can be participated in by people outside of Texas, but just saying, it's a really great, and they do take insurance. It's not expensive. It's great. So you can look for those kinds of things at local areas as well. Maybe local universities or hospital, teaching hospitals and things like that. So what is radical acceptance? It's basically taking what you have to accept. It's saying there are things in life that I did not cause, that I can't cure, and I can't control. So there are things that happen to us that we really don't want to deal with. We don't want to focus on. We don't want to feel those. We don't want to hurt. And a lot of people do escapism, and they distract, and that's great. For a time, we have to do that. But distracting, I've learned, especially in the past year, 2 years now, really can only go so far. And because when you come back to it, you still have to deal with the situation. And at night when you can't sleep, or when there's nobody to talk to, or you've watched the news for the nth time, it's the same reruns. And I'm a news junkie, right? But you just get tired of it, and it just comes back to that pain of, why do I not want to get out of bed? Why do I struggle with this? Why am I, whatever. And so for me, some things that I have to radically accept and just accept it is then my family. Now, I'm being cautious here because this isn't all of my family. This is just certain members. My family just doesn't care. I didn't cause that. I can't control this or them, and I can't cure this or them, their way of thinking. I was rejected by, I'm not going to name a name there. This person, in the past wanted to be with someone else more than me. They actually never wanted me. Or once they saw me in the flesh, they just wanted to use me for, I put narcissistic supply, but you could just fill in whatever. Another thing I have to radically accept is that I have borderline personality disorder. Don't like that. Another one is that I have major depressive disorder, and it's caused by grief. It's biological, it's genetic, it's environmental, and can be caused by trauma. So those are some of the things that I'm working on this week, trying to radically accept. We'll talk more about this in the future, and I'm going to tell you a little bit more about some of the DBT skills that I'm learning in another video. But thanks for watching. Take care.